Changes to the breasts can be dissatisfying and make a woman feel as if she's losing her femininity and youthfulness. Over time, factors such as age, genetics, pregnancy and breastfeeding, and weight and hormonal fluctuations can change the appearance of the breasts. Breasts that were once firm and shapely may begin to sag, giving them a loose or heavy appearance. A breast lift or mastopexy can help restore a firmer, shapelier breast, which will improve body contours and give the breasts a perky, youthful appearance. Breast lift procedures typically last 1 to 2 hours, depending on the complexity of the procedure and whether an additional procedure, such as breast augmentation, is performed at the same time. Your surgeon will draw incision guidelines on your breasts. If the size of the areola is being reduced, the incision guidelines will show this change. Before surgery, an anesthetic will be administered. Your surgeon will determine whether local anesthesia with IV sedation or general anesthesia will be used. The physician carefully makes incisions along the pre-marked lines. The upper incision extends above the border of the areola. This area marks the new upper edge of the areola. The area below the areola will be pulled together and tightened, lifting the breast. Using a variety of surgical instruments, the physician lifts the skin and separates it from the tissues below. While the breast skin is removed, the areola nipple complex is left intact. Some doctors may choose to use internal sutures within the glandular tissue, or a mesh product to give the breast additional support. Once the excess skin has been removed, the new skin edges are brought together and temporarily held in place with surgical staples or clamps, revealing the basic shape of the new breast. Next, the nipple areola complex is slid into its new, higher position. The physician will close the incision by placing internal dissolvable sutures around the new border of the areola and along the skin edges. Some physicians choose to place external sutures along the incision as well. Before closing the incision completely, the physician may place a surgical drain inside each breast. Lastly, surgical tape or bandages are applied to protect the incision sites as you heal. Breast lift procedures are typically done in outpatient surgery facilities, meaning you should be ready to go home the same day, usually within 1 to 2 hours following surgery. Before you leave, your doctor may fit you with a compression dressing or bra to help reduce swelling by preventing fluid buildup, as well as provide comfort and support as you heal. You may also be prescribed medication to manage your pain for the first few days and as needed. You will notice a dramatic difference in the shape and position of your breasts immediately following your procedure. You may continue to notice a change in the appearance of your breasts as swelling decreases. It may take up to 1 year before the final results from your procedure are apparent. Although you will have permanent scars following a breast lift, the scars may slowly fade to thin white lines with time. It is important to realize that if you become pregnant after having a breast lift, the effects of pregnancy and breastfeeding may affect the results and cause your breasts to sag and change shape. A breast lift cannot stop the aging process, but it can improve the position of your breasts and create the shapelier appearance that you desire for years to come.